Good morning. I'm Stephen Salloway, the Director of Neurology and the Memory and Aging Program at Butler Hospital and a Professor of Neurology and Psychiatry at the Alpert Medical School of Brown University in Providence. Today I'm going to be talking about challenges in developing breakthrough treatments for Alzheimer's disease. As you're probably well aware, Alzheimer's is our #1 public health problem in terms of cost and burden of care. It's projected that over 100 million people will be diagnosed with Alzheimer's disease worldwide by 2050. That's a staggering number. And this is the disease that older people most fear. And it's really the disability of Alzheimer's disease and the loss of identity that most concerns people. So our goal, and the goal now of the national plan developed by the U.S. Congress, is to develop breakthrough treatments for Alzheimer's disease by 2025. So there are a number of challenges along the way, and I will try to address some of those from my own experience working in this field for the past 25 years. The funding for Alzheimer's research at the federal level has paled in comparison to other major diseases like cancer and heart disease. Recently, there's been some improvement, and for the first time, we hope to have more than $1 billion in federal research for Alzheimer's disease in the coming year. And we still need to improve upon that, but at least we're moving in the right direction. In terms of treatment, there have been no treatments approved by the FDA since 2003. There have been a number of clinical trials focused on the amyloid pathway. There have been some disappointing and recently some encouraging results. There was a major trial, two phase 3 trials with bapineuzumab that showed a modest decrease in amyloid accumulation and also in a decline in phospho-tau and CSF, but no clinical benefit. We had some mixed results with another antibody called solanezumab, which binds to soluble forms of A-beta in two trials of mild to moderate Alzheimer's dementia. There was no overall clinical benefit. However, in a milder subgroup, there appeared to be some modest slowing of cognitive decline. And so a replication trial the results will be released soon. We recently had some encouraging results with an antibody aducanumab in a phase 1b trial that showed a substantial dose-dependent lowering of A-beta on amyloid PET and also a suggestion of a dose-dependent slowing of cognitive decline. So two phase 3 trials are underway, hoping to reproduce that finding in early Alzheimer's disease. So we're very much looking forward to that. However, one of the problems is it takes a long time to get a readout because of the time it takes to recruit the cohort and then follow the impact of the clinical trial. This is very exciting to enter the era of Alzheimer's prevention, but there are many challenges. A big one is recruitment of a much larger sample size and population than we've had to in the past. A big avenue is going to be through the media, all forms of media, social media, print media, broadcast media, to get the word out, to increase awareness, to lower stigma, to tell people about that Alzheimer's. We hope that Alzheimer's will be a much more treatable and manageable disease, especially if caught early. And so the media can play a huge role. Following the results of the publication of the aducanumab trial in Nature, we had 500 people call our center volunteering for research. So media is critical for getting the word out. So in summary, our goal is to detect risk, initiate treatments early, engage the public, develop new public-private partnerships to move the field forward, make investments in research on the clinical research side and on the basic discovery side